Hi, I'm Sheila Reed from Calgary, and 3 days ago I had hip surgery, and I'm walking around and feeling really good.
One facility, one team, one case manager, one new pathway.
It's been amazing because, first of all, I haven't been shuffled from doctor to doctor. I've had surgery done before, and I've waited over a year and had to see 3 different doctors, long waits in between. This was seamless. 2 weeks, and it was going. I was set up. It was wonderful.
George Morley and Sheila Reed are part of the Alberta Hip and Knee Replacement Pilot, a $20 million program aimed at finding a better way to deal with increased demand and large backlogs.
Our feeling was that the pieces of the system were operating in silos from each other, and there was a need to integrate them again from a patient's perspective. So you have to take a step back and say, why are we doing this? Why are we all in this business to begin with? And it's to make things better for patients and the public. We try to make it as close to one-stop shopping as we can.
Here's how it works. During the pilot phase, they will perform 1,200 hip and knee replacements. For the client, it begins with an assessment by their treatment team, a nurse who works as a case manager, a surgeon, and a physiotherapist. The team works together to determine the right course of action. The case manager then books all the necessary consults and appointments.
We see the patients from the time that they come in. We see them while they're having their surgery here. We see them afterwards. We see them at 2 weeks, again at 6 weeks and 3 months.
Having the case manager is great because you can call her if you have a problem and you can get an answer right away.
If I can't answer the question, then maybe the physiotherapist can, and if I can't, then I phone the doctor and then get back to the patient.
We can, as a team, discuss what the next steps are, if they're going to be surgical or non-surgical, and the patient being part of that discussion is quite a big difference.
Patient involvement is a big part of the new pathway. In the weeks leading up to surgery, the case manager and the physio educate and prepare patients in small groups on what to expect before and after surgery. This helps prevent future problems.
At any time, please feel free to ask me questions, and I'll try to get those answers out to you.
They explained the process completely. We came to classes. We knew what to expect. I had a knee replaced, and I knew it was going to happen all the way through. It was great. Never missed a beat.
We can optimize them prior to surgery, both physically and mentally. When they leave the session, they're way more relaxed about the whole medical and rehab portions of the procedure.
A huge part of the success of the new pathway is a streamlined surgical process. The pilot uses dedicated ORs, surgeons, and support teams in Edmonton, Red Deer, and Calgary who only perform hip and knee replacements.
We can do essentially a third more total joint replacements in the same amount of OR time because of a dedicated OR team staff that does the procedure in a repetitive fashion. So it's good for patient outcomes because it's a safer environment where there's less chance for surgical error or less chance for complications to occur.
All these efficiencies have made a huge impact on wait times and patient outcomes. The average length of a hospital stay is down from 6.2 days to 4.3 days. The average wait from first surgical consult to surgery is down from 47 weeks to 4.7 weeks.
It's the wear and tear on a bad joint. It just keeps getting worse and worse and worse. So this is wonderful to be able to get it in fast and get it done.
We spend a lot of time in our regular practice counseling patients on long wait times, trying to manage their pain and their disability so they're in pain for a shorter period of time, and then quality of life improves at a quicker rate.
In order to measure the success of the pilot, data on access times, quality, safety, patient satisfaction, and outcomes is being captured in a central database.
It removes the mystery of access, quality, and cost that have to be measured to make good decisions. And we can do this with good information, not hysteria around our system is broken and we can't fix it.
So one of the activities of the council is to try and get people to rethink how business is done. All of us in healthcare wind up on some sort of treadmill where we're working so hard and so fast that we don't have the time to stop and rethink how we're doing business.
It seems relatively simple to take a step back and connect the dots again with the case manager, making sure the right things are done at the right time, the first time, every time. So we do need to use those type of business approaches to realigning our health system.
I think I'm probably a testament to the healing process. It turned out real well for me. Yeah, so good in fact that I'm coming back for another day.
George is getting his final checkup in 6 weeks. His second knee surgery is booked the next day.